New year, new plans, specifically new Medicare prescription drug plans with new deductibles, new pay stages, and new tiers for all of your prescriptions. Hello and welcome all to our brand new show, Building Blocks. My name is Trey Basa, a licensed health insurance advisor with Market Medicare Advisors. Here on Building Blocks, I aim to build your foundational knowledge of everything Medicare, one block at a time. Today's focus will be entirely on prescription drug plans, whether a standalone prescription drug plan or one that's built into your Medicare Advantage plan. If you're on Medicare, this episode is for you. I want to talk about the idea of the show, specifically the episode. It's coming from a number of phone calls that we're getting from clients today. People are calling in beginning of January, filling all of their prescriptions in one go. And all of a sudden, they're spending more than what was promised in our annual enrollment review last fall, October 15th through December 7th. What I want to highlight here is we talk about in review for an entire calendar year, not just January's fill or May's fill. When we're comparing plan to plan versus year against year, we're taking a look at how much you could be spending and how much you could be saving on all of these different plans. So with all of that being said, most of these people are calling in wondering why they're spending so much on prescriptions. And I say to them, that's because you haven't fulfilled all of your pay stages. Not yet. We talked about the year and saving money over the course of the year, but it doesn't feel like that when you first fill. So our first building block today is going to be the tier system of prescription drug plans. Knowing's half the battle, right? Knowing how your prescription drug plans put your prescriptions into these different tiers will tell you how you will pay for your prescriptions throughout the year. So take a look at this very plain tier system. This applies to every prescription drug plan. Now keep in mind, every year prescription drug plans change. Coverage changes. The Medicare system as a whole changes every year. You have to review your list of prescriptions in your plan every year because this tier system is going to dictate how you pay for your prescription drugs. This tier system for your prescription drugs is called a formulary. Formularies put your prescription drugs into tiers 1 through 6. When you are fulfilling your prescriptions throughout the year, your plan is going to reference this formulary and determine how much you pay for your prescription drugs. Every year, private insurance companies have a board of pharmacists and doctors that review this formulary for their plans, and they modify every little part. What tier a prescription is in, the deductible you have to fulfill, the cost of your monthly premium just to be a part of the plan, etc. That's why it is important to review and pick the right plan for your list of prescriptions every year. With our second building block, we're going to build off of this tier system. There are different pay stages that will affect how you pay for your prescription drugs. Starting in 2025, there are only 3 pay stages. And the first pay stage is going to be the number one culprit to that feeling I was just talking about. The feeling of that first fill of all of your prescriptions in January and why it's so much more expensive then versus the rest of the year. The feeling of not saving any money on your prescription drug plan. That is due to our first stage, the deductible. Now, when we were talking about the formulary, there were different levels. So tier 1 and 2 are going to be the lowest levels, and they are covered from day 1. But higher tiers like 3, 4, and 5, you have a deductible to fulfill. You're paying 100% of retail costs for tiers 3, 4, and 5. Now, this deductible is different for every plan on the market. So it's important to weigh the cost of the plan, the deductible, your list of scripts, and what best works for you. Like I said, lower tiers, you get coverage immediately, but you're paying 100% of retail costs for tiers 3, 4, and 5. But after you've met that deductible, after you've paid into the plan so much, you move into our second stage called initial. And initial coverage is going to be where we're getting coverage for tiers 1 through 6, the entire gambit. Like I said, tiers 1 and 2 are going to be for the generics, for more common things that people are being prescribed. High blood pressure, cholesterol, thyroid, all of that fun stuff. But tiers 3, 4, and 5, the more expensive stuff, the more brand name stuff. Now that you're in the second stage, your initial coverage, you finally get some assistance for the more expensive brand names. When we're looking at how you are fulfilling your prescriptions in initial, we are going to meet a threshold. And this year, that threshold is set at $2,000 on your prescription drug plan through the deductible and your initial stage. Once you have spent $2,000 on all of your prescriptions, you have a $0 copay in what we call catastrophic coverage. Thanks to the 2002 Inflation Reduction Act, this maximum out-of-pocket of $2,000 has been in the work for a few years, but 2025 is the first year we are seeing this come into play. So again, once you've fulfilled your deductible, you spent so much money in initial, and it all adds up to $2,000 out of your pocket, you move into the third stage, catastrophic, where you have a $0 copay for all of your scripts for the rest of the calendar year. What better note to wrap up the episode on a high one? $0 copayments for prescriptions. With these two building blocks of information, we here at Market Medicare Advisors sift through all of the plans on the market in your zip code to make sure that we're finding the right fit for you. Every year, we encourage our clients to meet with us between October 15th through December 7th to review all of the plans to make sure it is going to be the best fit for them. Like I mentioned, these plans change every year. Premiums and deductibles, not to mention the Medicare system as a whole. It's important for you to find the right plan for your list of scripts. If you have any questions about your particular prescription drug plan or prescription drug plans in general, please feel free to give us a call at 316-252-8707. That's 316-252-8707. Or you can email us here at mail@marketmedicareadvisors.com and connect with us today. That's going to be it for our first episode of Building Blocks. Be sure to subscribe to stay tuned for more videos just like these for all your Medicare needs. Don't forget to like and share so you can help your friends and family by getting them the information they need to know about their Medicare plans. You can catch this show and our entire catalog of shows on our channel, youtube.com/retirementhelp, where we archive all our previously recorded and aired shows, where I and other retirement professionals come together in one place to talk about how we're actively working with clients today and preparing them to live their best lives in retirement. I've been your host, Trey Basa. Thank you so much for joining me here on Building Blocks, building your Medicare knowledge one block at a time. I'll see you guys in the next one.
Unless otherwise indicated, all client and prospect names mentioned on this show have been changed to protect the identities of the individuals discussed.
The content provided is intended for informational and educational purposes only. The views, statements, and opinions expressed herein are those of the individual speakers. This is not endorsed or affiliated with any U.S. government agency, the Social Security Administration, or associated with any federal Medicare program. We do not offer every plan available in your area. Any information we provide is limited to those plans we do offer in your area. Please contact Medicare.gov or 1-800-MEDICARE to get information on all of your options. Investment advisory services are offered through Foundations Investment Advisors LLC, an SEC-registered investment advisor. All rights reserved.